welcome. So as we have attendees starting to come in and get the videos set up, I first just wanted to give a brief introduction. My name is Colin Fedor. I'm Representative Garlick's Chief of Staff, and I'm excited to be here, albeit virtually. I do miss being at the Dover Townhouse. But first of all, welcome to Representative Denise Garlick's report to the Dover community. Just a few housekeeping tips. Maureen, if you wanted to go to the next slide. We've enabled the chat feature here to have questions. So during the presentation, just type your questions into the chat as we go, and we'll be sure to leave time at the end of the presentation for those. If you are watching on Dover Sherborne Cable TV, go ahead and call 617-871-0218 and leave a voicemail. Isabel Lane in our office is monitoring the chat and voicemail for themes. So at the end, we'll ask questions that have been shared by many and then proceed to the more specific questions. So without further ado, I'd like to turn it over to your state representative, Denise Garlick.
So good evening to everyone. I too miss being at the Dover Townhouse, and I hope that anyone who is listening here feels themselves virtually hugged. I wanted to talk about our evening tonight, in which we will have a 30-minute presentation on a report to the community. I have been asked by two prominent Dover people if we can squeeze some extra minutes out of that. So I will do this as briskly as possible so we have more time for conversation. We will speak about the following four subjects, and then we'll move on to questions and discussion. I do want to take one moment, though, to reflect very carefully on what this pandemic has meant to the town of Dover, to the people of Dover, their friends, their family, and all of their neighbors. Dover has suffered 146 individuals who are positive for COVID, and Norfolk County, in which we reside, has experienced over 1,416 deaths. To all that have suffered and are thinking of their family, my heart is with you. I want to say a thank you to my team. You've heard Colin's voice this evening. He is my Chief of Staff. Maureen Callahan is the District Legislative Director, which many of you are meeting and working with. Isabel Lane is my legislative aide and is the Chief Architect of a lot of the communication that we share with. And Philip Lynch is the Legislative Director. They are extraordinary young people who are dedicated to good government and who bring their many skills and talents as we serve the town of Dover. As you know, I represent 40,000 people, including your neighbors in Needham and your neighbors in Medfield's Precinct 1 and 2. Next is just a brief synopsis of the positions that I have held in the time that I have served the town of Dover and presently in this new session coming up. One of the things that is most important is the way I can listen to your concerns. And I feel like I'm hopeful that you feel like we have activated a variety of ways to be in good touch with the residents of Dover, as well as the town of Dover staff and elected leadership. One of the most powerful things that we have been able to activate during this pandemic time is the communication. In the very beginning of the crisis, the COVID crisis, we were communicating in daily updates for 79 days straight. We then moved in over the summertime to a Tuesday, Thursday report. And now since September, we have rebranded ourselves to the Garlick Press. And in all that time, we are sharing what we believe is the most important information you need to have that is occurring statewide and the most important information that you need to have for the town of Dover. So when I talk about being connected to the town in ways large and small, I want to talk about the water contamination issue. Not only was Dover wrestling with a pandemic, but in the middle of this, there was a water contamination issue. And because I am connected to the town, was very quickly able to weigh in as part of the team, along with my colleague, Senator Mike Rush. We helped to identify the problem, and then a solution, which is one of the things I could do as your legislator, was to convene the meetings with the Department of Environmental Protection And I want you to know, in the things that we have learned, we are moving forward, the senator and I, to file legislation to strengthen the Department of Environmental Protection and require emergency planning around water contamination issues. And connecting with the community to understand the other other important issues. I have listed them here. All of these issues were brought to me by constituents of the town of Dover and were a focus for us during this year of the pandemic. The COVID-19 and the stay-at-home advisories have affected everyone. And one of the things that I think is very important to talk about is the mental health issues and the substance misuse issues. And I'm hoping this is going to come up in our question and answer period. And so what has been the response? So there has been a federal response to the pandemic, a state and local. The federal certainly was around the packages of resources that we received, and I'll talk about that a little bit more later. But I want to tell you, as your representative, the federal response was too little and it was too late. But we continued to do our work. On the state level, we saw both legislative action, and on March 10th, the governor declared a state of emergency. And from that time forward, we have seen a great deal of executive actions take place, particularly concerning the mask mandates and the reopening, as well as unemployment assistance. And on a local level, the Dover town government has been extraordinary in their efforts to communicate with the residents of Dover. And I want to take this moment for the Board of Health, who has taken on tremendous responsibility. And you know that these are your fellow neighbors who are volunteering and took on this great task of dealing with the pandemic and the water contamination issue. The Council on Aging has been on the forefront and has done programming both in the outdoors and doing it remotely, and the many community organizations in Dover that have helped to keep the town of Dover and their residents to feel cohesive and connected. One of the most important things that can happen during this time. There were also legislative actions that you'll see related to COVID-19, and some of the most important that I dealt with residents in Dover was around the discussions on mail-in voting, on the public health funding and data reporting, which we'll talk a little bit more, municipal flexibilities, and the delayed income tax filing deadlines. I wanted to highlight down below in the banner, you'll see the SAFE Act. SAFE stands for the State Action on Public Health Excellence. This is something I have worked on since 2014. In 2016, we established a commission. In 2018, we brought legislation. We voted on the legislation the first week in April. These are legislative language to strengthen local and regional public health. It wasn't driven by the COVID pandemic, but it became absolutely essential because of it. And we are now building on what we have learned, and I am filing legislation on SAFE Act 2. We need to strengthen our local and public health. Massachusetts is known for our healthcare infrastructure, but I'm telling you that does not necessarily translate to our public health infrastructure. And finally, I would like to talk to you about the budget appropriations and the relief that the town received. There have been 4 streams of revenue connected to the pandemic: the CARES Act, the Coronavirus Relief Fund, the Elementary and Secondary School Fund, and the COVID Student Supports. The COVID Student Reports is a House-driven initiative that deals with issues that might come up related to ventilation, remote learning, PPE, and likewise with the Elementary and Secondary School Emergency Fund. So with that, thinking about COVID, I want to move on to the general budget issues. So on the general budget issues, I want to very briefly just say to you, you know that I serve as the Vice Chair of Ways and Means. In this one calendar year, we have dealt with 3 state budgets, and it is because the writing of the current FY21 budget, which we are in until June 30th of next year, was done piecemeal, month by month, from essentially April through December, because we needed to ascertain the revenue for Massachusetts, and we were waiting for any federal aid that the state and municipalities would receive. And we are now planning for FY22, which will begin on July 1 of 2021. The next is the issue around the Dover budget itself. One of the things that the legislature did very early in the pandemic in April was we committed to the town of Dover and the towns across Massachusetts to hold stable local aid, which is money the town receives, as well as the Chapter 70 money, which is the education money. This was very important. We promised this money, we delivered on that promise. We knew that for all the municipalities to be able to build their own budgets, they needed to have stable, sustainable, and predictable resources. Another issue that was related to the budget was around the small business supports. This is important in Dover. Dover is not the home to many small businesses, but is the home to many residents who have small businesses across this Commonwealth. And the work we did around the state grants, the unemployment legislation that we'll talk about a little bit more, the restaurant support, looking for the federal support, and how we were going to deal with the taxes and the unemployment insurance taxes, a discussion that is continuing, was vital to stabilizing our Commonwealth. I'm going to highlight for you a few areas in the FY21 budget that was important, and I was contacted directly by residents of Dover. One of those is around the developmental services budget. You know that DDS serves individuals with intellectual and developmental disabilities, as well as children with autism. And we kept this budget stable and strengthened this budget, in fact. The second issue is related to the environment. We have many constituents in Dover who have contacted me about the budget related to the environment, and many young people in Dover. I want you to know we have a very active Dover-Sherburne High School contingent of active citizens. And one of those was around the state parks, because we know that an amenity like the state park became more valuable as we look to other ways to recreate outdoors and safely. The next one is the food security budget. This is an issue in Dover. It certainly is an issue in Medfield and Needham as well. And it is a devastating issue across our Commonwealth. And many stakeholders and advocates, including people from Dover, contacted me on this issue of food security. It has been a constant effort of the legislature to fund food security, and we will continue our commitment to do that in the months ahead, and hopefully in the years ahead as well. And finally, on the FY21 budget, we had monies related to the one-time revenues. This is important. I wanted you to know that we had revenues coming into the Commonwealth, but you cannot build a budget on one-time revenues. You can fill a gap, you can look at an initiative, but it is not the money that we can build a budget going on forward. And finally, on the issue related to legislation, there are many Massachusetts legislative accomplishments when we are not only trying to sustain our Commonwealth, we are trying to make it stronger. So I wanted to talk to you about, these were some of the key legislative action items. And I know when that you're looking at this, you may see something that you would like to discuss further. I would like to highlight a few of these legislative pieces for you. The first one is the racial equity and law enforcement reform. I heard from many people in Dover on weighing in on this issue. I want you to know that I certainly was in discussions with the Dover chief, as well as Dover students, which was very, very important to me to be speaking to these young people, and many Dover residents as well. In passing the law enforcement reform bill, there were four main pillars. One is around the Peace Officer Standards and Training Commission. This commission is vitally important because for the first time, and one of the only states in the nation, we are going to certify law enforcement people. That's giving them the education that they need and deserve, and saying this person is able to certify this person to fulfill the duties of law enforcement. It also allows the Commonwealth to restrict, revoke, or suspend certification of offices, agencies, or academies One of the things I learned in this time, and I learned firsthand from a chief in another town, was how much the job of law enforcement has changed, even though the education and training has not. We also dealt with the issue of duty to intervene. The work related to racial equity in law enforcement has been ongoing for years in the legislature. But of course, it received the urgency to pass this legislation was because of the murder of George Floyd and all of that we were learning about race equity. The duty to intervene is directly responsive to the officer who kept his knee on the neck of George Floyd while 3 other officers looked on. Given this legislation that has been passed, that will never happen in our Commonwealth because all officers will have a duty to intervene. There were discussions about use of force appropriate and what could be used and what cannot be. And there's language about review of civil service. And this is something that's going to be in a commission. It is actually a result of many, many different opinions around civil service and wanting to ensure that whatever process we use going forward gives us the strongest pool of candidates to be our law enforcement officials. This bill also dealt with racial inequities related to maternal health and the presence of institutional racism in correctional facilities, the parole process, and probation services. Another very important piece of legislation that I supported was promoting a resilient healthcare system. This we learned, there was so much that we learned during this pandemic. And one of the most important things that I, as a nurse for many decades, was stunned to realize when I would have told you the greatest relationship you can have is the one-on-one between the healthcare provider and the patient, is how the telehealth coverage has made a difference to so many people. It has worked better than was anticipated, and it has been particularly powerful with people with mental health and behavioral health issues, and they have found it to be very therapeutic, and we are now providing insurance coverage for that. Additionally, because we needed every person on their feet practicing to the full extent of their license, we expanded practice for our nurse practitioners. And for many people who need to seek care where they are, and we have dealt with the issues of out-of-network and surprise billing. I am also a strong supporter and advocate of the reproductive health bills that were passed. You know, in 2019, we believed it was the year of the woman. 2020 became the year of the virus. But in the year of the woman, we worked on and passed legislation related to Title X funding, to the Nasty Woman Act, which was just an acronym, but it was to get rid of antiquated laws on Massachusetts books. The Patch Act, which ensured confidential access to healthcare services, and the Access Act, which was a reaction to the Trump administration pulling back on insurance coverage for contraceptives. In Massachusetts, we provide access to copay-free contraceptives. Voted into this law this session was an act providing access to reproductive health service. This is the Roe Act. I heard from many people in Dover, both who supported this legislation and people who were deeply concerned about it. I wanted to be on the record with all of you. In all the time that I have served Dover, I have been a strong advocate for a woman's right to choose. As a woman, as a mother of daughters, as a nurse, and as a legislator. And I believe in access to quality health care, to education and advocacy that this law provides. And I wanted to share with you that I was heartened by the number of men who also were weighing in on this with their concerns, with their support, because we know that this issue around reproductive health is not just a woman's issue, but concerns men and certainly concerns our families. And finally, I wanted to discuss with you the next generation roadmap for climate policy. Here again, I want you to know that a very strong constituency of Dover students have weighed in on this, as well as many concerned Dover residents. This is the climate bill. This is the energy and environment bill with a 2050 roadmap to get us to net zero carbon emissions, to increase Massachusetts' capacity for solar and wind. And very importantly, it's a jobs bill because clean energy is a way for Massachusetts to develop jobs. And like many other issues that in 2020, in all that we learned about race equity, there is a lens for environmental justice here that requires that there is an appropriate evaluation of the impacts of public health on communities. And on the economic development bill, this is the final bill that we saw that is about, we are sustaining Massachusetts. We are strengthening Massachusetts, but we believe that we are on a pathway to prosperity, and we are setting that pathway through science and technology research, through the arts. You know, we cannot forget how important the arts are, but we activated $626 million on bond authorizations over the next 5 years so that we can make sure that the Commonwealth is well positioned moving forward. And finally, on the issue of strong leadership, I mentioned to you that I am the vice chair of the Ways and Means Committee, but people often ask me what that committee actually is. The Ways and Means Committee sits at the absolute nexus of policy and budget. Any bill that has a financial impact must go through the Ways and Means Committee before it goes to the floor. That means that I see every bill that is coming to the floor to be voted on, and I have the ability to work on those bills. Budget is around resources. And, you know, I always say to people, you know, a good idea without money is just a good idea. If we're going to develop public policy, we need to be able to have the resources to move that forward. I wanted to talk to you as well about leadership on the COVID-19 working group. I was appointed by the speaker to lead the 5-member group for the House of Representatives. I think there are many reasons that I was chosen. One of them is that I am a nurse. The other members of the committee were a representative who was an emergency room doctor at Boston Medical Center as well. One is a very new representative, but who brings 20 years of emergency management experience. And the other two were both the chair and the former chair of the Joint Committee on Public Health. Our charge was to keep the House of Representatives cohesive, to continue to use the policies and protocols we have through our chairman, our chairpeople, and our committees, and to develop policies that would keep the members and the staff safe, and to, in that, keeping people cohesive, making sure they had the information that they need to do their job. I am the liaison with the command center, and additionally with weekly calls from March to September with Secretary Sutters, and now bi-weekly calls. And she is the commander of the command center and the Secretary of Health and Human Services. We have managed a daily questionnaire, which is any representative can ask a question. All representatives get the answer. We have managed over 800 questions with the command center. House operations was how we can continue to do our work and keep the House safe and secure, and the members and staff. And Massachusetts, you may know, is the first legislature that moved to secure remote voting in the nation so that we could continue our work. And additionally, we do a myriad of information briefings on anything mass bio to crisis and leadership in a crisis. And on Thursday, we will be engaged in a briefing on vaccine distribution with Secretary of Health and Human Services. And additionally, I was also the lead on a caring collaboration for vulnerable children and families. This is directly related to DCF. We need legislation around holding DCF accountable for their work, to strengthen the work that they are doing, which is what quality improvement is, to help to recruit and retain foster parents in a system where these foster parents are now exhausted, and it as we move into the future, we will need to be able to have a strong foster parent system around DCF's COVID-19 response and around a child fatality review. I will share with you that this issue is difficult and complicated, and there are the stakeholders for me are the children and the families and DCF. There are a myriad of advocates, and at every single step, my staff and I, our most important value was in the best interest of the child, and I will continue this work. We are very concerned. There are very low numbers on abuse and neglect reported through something called a 51A. And I don't believe that is because there has not been abuse and neglect during these incredibly stressful times. I believe it is because many of the children have not been seen because we are not holding childcare or in school or coaching, out of school sports, the many ways that many adults see the children and can identify their needs. And finally, I wanted to share with you that as we move forward on the policy and budget issues, these are the issues I think we will need to watch in 2021, but you and I have both learned that on a daily basis, we are seeing unanticipated needs, and we are pivoting as quickly as we can to meet all of the issues and concerns of certainly the people of Dover, but the residents across our Commonwealth. Finally, I want to take a moment. I want to speak to you about the Dover community. I have listed some members of the Dover community here. I want to tell you what extraordinary partners they have been in all of the work that they've done. I work with my colleague and your Senator, Mike Rush, and in the work that has happened, the communication and the commitment from the town administrator through every single board, through certainly the school superintendent and school committee, and with Dover Sherburne as our strong partner, sharing information on an ongoing basis. We are very fortunate. And I believe this is one of the reasons that Dover has been cohesive and strong during this pandemic. I do want to say thank you to the Dover Sherburne cable folks. And I wanted to share with you, at the time we scheduled this report, we were very careful last fall to ensure that we would not conflict with the Board of Selectmen meetings or with school committee meetings. We did not anticipate that tonight was Governor Baker's State of the State. I hope, like me, that you will watch this show again on Dover Sherburne Cable, and I'm sure that we will all get coverage of the governor's speech as well. My staff and I are always available to you. We are working remotely. We are working constantly. And please email me at my email address, and you know that we will get back to you, and your needs, your issues, your concerns are our needs, our issues, and our concerns. And at this time, I'm hoping we have stolen a few extra moments from the report so we can have extra moments for our conversations. And I turn this over now to Colin, if you could help me as we field some questions.
Yeah, so thank you very much, Rep. Garlick. Isabel Lane, our legislative aide, has been tracking the comments that have been coming in. So she has a couple of questions from the residents of Dover. So I'll turn it over to Izzy to ask those questions.
Okay, thanks, Iz.
Hi, so we got a couple of questions about the COVID vaccine. So I just wanted to open it up. If you could talk a bit more about what the vaccine distribution would look like in Dover. Yeah.
Okay, so we do not have a ringer in the audience, but I want you to know that I anticipated this question around vaccine distribution. So I'd like Maureen, we have two slides up on this. One of the things that you all are aware of, announced yesterday, was that the governor is moving individuals who are 65 years old up further in the phase 2 vaccine distribution. This is in response to the many, many people that are asking for the vaccine. It actually develops a conundrum because in order to do that, he has then moved the early educators and the teachers down further. But I will tell you this. The issue around vaccine distribution is complicated by the fact, and this is the honest to God truth, that we do not have sufficient vaccine in this Commonwealth. And this is a complicated issue in which, number one, the federal government under the Trump administration overpromised and underdelivered. It's also part of the fact that we prioritized our healthcare and first responders. In Massachusetts alone, we have over 800,000 people who are healthcare providers who are COVID-facing patients. So they're hands-on with people, emergency responders. Our number is very high. When we talk about quality healthcare in Massachusetts, it is because of the number of healthcare providers we have. But that meant that in other states in which you hear they're receiving vaccine, they did not have to cover that first cohort of so many people. Another thing that is very true is that there disproportionate vaccine allocation between red states and blue states. And Massachusetts certainly needs much more vaccine than we have received. I do believe the distribution sites are going to be available. We're talking about a number of major distribution sites. We have 165 individual sites. The town of Needham has been approved to be a site that continue to give out vaccines. This is important because I keep connecting Needham, Dover, and Medfield together. We were able to, I strongly advocated for vaccines so that the Needham Health Department could vaccinate the first responders in Needham, Dover, and Medfield. I will continue to do that to try and keep those three towns together, continuing to advocate for more vaccine. I am heartened today that Joe Biden, the president, has increased the commitment to get more vaccine to the people of our great country, and is talking about having 200 million people vaccinated by the end of the summer. For anyone who is frustrated by this report, confused by the registration forms to sign up for, overwhelmed by where we should go to get our vaccine and how we should get our vaccine, I feel exactly like that. And I will work on this issue. And I will work on it not only in my work as the lead on the COVID-19 group for the House of Representatives, but I will work on it as a person deeply committed to public health. You may know that I served 2 terms on the Board of Health in Needham before serving on the Select Board. And I know that we need to strengthen our public health, both locally and regionally.
Awesome. So the next question you received is regarding the FY22 budget, and more specifically looking at the Chapter 70 funding, just seeing if you had any insight into what that might look like in this upcoming year.
Yes. And I want to say thank you to Iz for saying awesome. This is hard to do remotely, so I appreciate that. I'm sure that everyone is going to be very heartened to hear that the governor is giving his state of state tonight. We'll be releasing his budget in the upcoming days. And in that budget, my understanding is a promise to fully fund the Student Opportunity Act. You may know that when we pass the Student Opportunity Act, which will increase the monies that go to both the communities and overall to focus on students with English language learning needs, with special needs, that was done in the very best of times. And I think there has been grave concern about how do we move forward with funding that education. And in fact, the Commonwealth is going to commit to funding that education at that level that we saw in the Student Opportunity Act. And I think as you're teeing up the next question, I want to give a real shout out to the educators in both the Chickering School and the Dover Sherborne Middle School and High School. I believe it is hard for those of us who are not in the education field to understand the great workload they've taken on, how they've pivoted to new ways to work, and to the anxiety and concern they have in their workplaces related to the virus. And I am deeply heartened at what I've seen as the commitment of the educators in our Commonwealth. I do believe they need more support.
So as discussed, 2020 brought light to many issues of racial equity across the Commonwealth. The legislature addressed this through developing the Independent Police Review Board and the Police Reform Bill and creating a commission to study the state flag. Can you speak more on these efforts from this last year?
So I want to tell you a little bit of the story around the law enforcement bill, and that's what we were referencing at the beginning of that question. So Massachusetts, like the rest of the country, reacted in horror to the George Floyd murder. And I think for many people, we learned more, we saw more. I think for many people, including me, we have a lot more to learn and to understand. But when we did the law enforcement bill, we did this in partnership. The House of Representatives worked in partnership and looked to the leadership of the Black and Latino caucus in the House of Representatives. They brought to us 4 principles that they said that they believed had to be in the bill. And every single one of those principles is in the bill and were those areas that I highlighted to you before. I believe that we have seen, not only in law enforcement, a real rising consciousness around race equity, but we're seeing it in the ravages of the COVID-19 virus. When I talk about food insecurity, I am, of course, concerned about the people in Needham, Dover, and Medfield. I am concerned about the veterans who lined up at Gillette Stadium to the tune of 20,000 cars a week looking for food, our veterans. I am deeply concerned about what we witnessed in Chelsea and Everett and communities that need our support around the food security issue. When I talk to you about the environmental bill, when we talk about environmental justice, this is something that is a lens that we always should have been looking at, but we are looking at more clearly now, or looking through, and around the impacts on some communities and not other communities, and what that means in relation to the impacts, both public health and financial, for those communities. And I believe that in every single bill that we have looked at, including the reproductive rights bill, there was language in there about maternal child health disparities when we know that people of color experience a higher infant mortality, a higher maternal mortality related to childbirth. So in each and every bill that we took up this year, we looked at it through that racial equity lens. And I believe we are strengthening the legislation that we're bringing forward. I believe we're strengthening the Commonwealth. And I do not think this is a one and done. I believe that once we have been able to see these issues, we will always see these issues, and our legislation will reflect that. All of this legislation, including the state flag legislation, I have been a strong advocate and voted in the affirmative for.
So the ROE Act includes provisions allowing women to access abortions after 24 weeks of pregnancy, and lowering the age of consent for an abortion to 16.
Right.
Can you explain these provisions for someone expressing concern regarding what the impact of these might be?
Sure. And first, I want to say how very respectful I am. This is an issue that people feel deeply, and I believe it is an issue of conscience. There are some bills that you weigh the cost and benefit for, and you can listen to different sides of the argument and be able to see a bills in a variety of ways. The issue related to abortion is an issue of conscience. So I can only tell you how I voted, why I voted, and express my respect for people who don't agree with me. But the first one was around dropping the age from 18 to 16. This was very important to me and something that I actually helped to negotiate because the original legislation wanted no age at all. They wanted to have an individual who was 12 years old could get an abortion, and an individual who was 13. And I did not support that. And I said that 16 is the age that society accepts for sexual intercourse. Let's face it, right? You know, if you're over 16, society seems to accept that. If you're under 16, that's statutory rape. So to me, the age of 16 was the line that I could draw in the sand. Someone who is not 16 years old, 15, 14, 13, 12, 11, young girls are entering puberty, younger and younger, it seems, right? To me, these are children. And I want to ensure that children would have support in making these decisions. If that ever has to be made, there are about 100 individuals less than the age of 16 who might need to access these services. And I wanted to ensure that there would be a real process for them. The second piece that I was asked about is over 24 weeks, right? So 24 weeks is a pregnancy. That language is about a fetal fatal anomaly. And that's not language that's really familiar to a lot of people. A fetal fatal anomaly is a fetus that will not survive the birth process. And some of these conditions are devastating. There is a condition, as a student nurse, I had an experience. I was a student nurse at St. Margaret's Hospital, actually the same hospital I had been born in, where a baby was born with, or was not born. The baby was birthed that had anencephaly. That's a baby that's born without a brain. There are very serious anomalies out there for which the fetus will not survive. And in those instances, I believe that an abortion that is desired by the mother is appropriate. And I do not feel like the legislature should be interfering in that decision. And did I miss any other part of that question?
Nope, you got it.
Okay, but I do want to share this because I believe it's a vote of conscience. Anyone who would like to continue this conversation with me, I want you to know that I'm very open to that. And it is my beliefs, my lived experience, both as a nurse and as a mother, that informed my vote. And I would always want people to understand how I voted and why I voted. And I will tell you as well that many people from Dover weighed in on this issue of reproductive health. And for many people, this bill was the goal they were working for.
Awesome. So before we move on to the next question, Janet Claypool from the Dover Council on Aging just wanted to have us remind everyone that starting tomorrow, seniors aged 75 and older are eligible to register for the COVID vaccine on the mass.gov website.
So Janet, thanks for weighing in. Thanks for being with us tonight. I wish I could see your face. And thank you for all the work that you're doing. So please, folks, sign up. And anyone, I'm sure, I don't mean to speak for Janet, but anyone who is having difficulty signing up should call the senior center and see if there is somebody there that can assist them. The registration process itself is not simple, I must share with you. So, and you got to get registered to get the vaccine. So get whatever help you need.
Great. So the next question is, how do you plan on voting for a doctor-assisted suicide end-of-life options bill that will most likely be coming up in the near future?
Okay, so language is really interesting, right? So you could use the language of doctor-assisted suicide, or you could use the language of medically compassionate care. And you're talking about the same bill. This bill has come before the legislature for every session that I have served, and we have not come to a resolution of this bill yet. But I would tell you as a nurse that I am aware that every single day people are making decisions about end of life. And for me, I would want to be part of that decision process. I would not want that decision process made about me or without me. So as I'm looking at the legislative language, and I haven't seen the new bill filed yet this session, I would tell you that I would lean towards voting in the affirmative on that bill.
So the next question, the ability to have town government meetings via Zoom has actually increased resident participation significantly. Will this ability continue after the emergency subsidies?
So that's something
Subsides?
Yes. So actually, this is something that we're looking on right now. When I talked to you about the legislation we filed during the COVID-19 time, in the initial parts of the pandemic, we actually passed legislation around municipal flexibilities, not only how we would vote, but how we would hold meetings and how we would hold town meetings. We have seen, just like the telehealth, right? Who could have envisioned that it would be as beneficial as it has turned out to be? We have seen the flexibility for municipalities actually allow towns like Dover to function more effectively, and more than that, to increase citizen participation. Even tonight, I think to myself that we had the storm warnings, that it would have been snowing. It would have been hard to come to the townhouse. Perhaps we have a conflict with another presentation. It would be hard to be able to balance those things. But because of the way and we're using technology, it's making it better. I've already spoken to presently, because we're in a new legislative session, we do not have a chair of municipalities presently, only because committees haven't been named. But I have already weighed in with other members who are in leadership around the flexibilities we gave municipalities and how we can maintain that. Further than that, I just got a notice that the Boston Marathon has been moved to October 11th. So for us who are thinking about Springtown meetings, it seems to me that we better move quickly on making them as flexible and doable as possible.
So as you may know, Dover's drinking water supplies come from private wells, 2/3 of the town's households, and public water suppliers, 1/3 of the town, especially the Colonial Water Company, which is Mass DEP and is supposed to enforce it, which Mass DEP is supposed to enforce regulations pertaining to its license to pump a certain amount of water from the ground. Over the years, Colonial Water has exceeded its water withdrawal amounts and has not promoted water conservation. Despite many requests to Mass DEP to enforce the terms of Colonial Water's permit, it has not enforced existing water withdrawal limits. Why not?
So just like during the COVID-19 time, right, during this pandemic, this is a terrible crisis we're going in for public health as well as financial hardship. But it's also been an opportunity to learn a lot. The water contamination issue in Dover and my ability to work closely with Dover's town leadership and Dover's town staff actually highlighted several issues to me. One is certainly, I believe that DEP needs to be strengthened. They didn't have strong enough enforcement capability during that time. They also, and Jerry Clark, I'm sure is thinking about this, we didn't have good data on exactly how much water was being drawn. And we have worked hard on making sure that we understand that. So then we didn't have good data. They didn't have strong enough enforcement, which is what we're trying to build into the legislation. And I do know that there is very strong leadership in the town of Dover that is looking to launch a public education campaign around the amount of water that Dover certainly was pumping more water, but they weren't pumping it to nowhere. They were pumping it to homes in Dover that were using the water. So I think there needs to be a public education campaign as well. But I am deeply concerned about the issue of water quality and quantity in the town of Dover. And I think for the last several years, we have talked about the number of wells being dug in Dover and how you have to go deeper each time a well is being dug to find the water. And I keep saying, because I represent the town of Medfield as well, Medfield is looking at developing the Medfield State Hospital property, right? And with residential homes. And that is Dover's decision. And there are many people that are committed to that. But between the Charles River watershed and Dover is Medfield. And so I am hoping there's going to be a strong working relationship between those two towns with a real focus on the water needs.
What is your assessment of the likelihood of overruling Governor Baker's veto of the environmental bill? What is your assessment of state action on climate change in Massachusetts?
So my assessment is that on Thursday, that bill, we are bringing back the bill that we voted on in session. We voted with an overwhelming majority of votes. We could override a veto. We ran out of time to get the bill to the governor to have him veto it and get it back to us so that we could override it. I am working with my colleagues. I am a strong advocate on this bill. This bill is vitally important to people I represent in Needham, Dover, and Medfield. I work with these activists, community groups, and I have every intention of overriding the governor's veto. And I'm hoping we will have that news by Thursday, when both the House and Senate are in session. And for both of us, the agenda is that bill.
So next question is just following back up with the question regarding racial equity.
Yes.
Is the flag change now law? I can confirm that it is law, but I wasn't sure if you wanted to touch anything more on that issue.
So what is law is the commission. There is a commission that is going to look at the flag change. I suspect this is something that's going to be complicated conversation in the Commonwealth, but I do believe that there is going to be a resolution of this when people look carefully at the flag of the Commonwealth. I believe, though designed in a different time, in our time today, we understand that the flag no longer represents our values, if ever.
Thank you. I can turn this now back to Colin, I believe, because we do not have any more questions.
Well, thank you. And I hope this format worked well. We were trying to maximize the amount of time we could get questions and answers done. Please let me know if this format worked for you. And Colin, let me turn it back to you.
Thank you. So we still have a few more minutes. So if there are questions from attendees, feel free to ask those away. Otherwise, thank you. I'll pause. Yep, so we're just having some participants saying thanks for the longer question and answer period. Thank you so much. So thank you again to everyone. We're happy that everyone is able to stay safe and healthy and warm in their homes. And again, like Representative Garlick said, if you have any feedback on this format, we are definitely all eyes and ears.
So once again, I want to say good night to the folks who have joined us, to the folks who may join us later. My thanks to Dover Cable, and my thanks to the extraordinary staff who has helped bring this program to you tonight. Thank you.